Hi, this is video lecture chapter 10. In this chapter, we're going to go over landmarks of the face and oral cavity. The dental assistant must be thoroughly familiar with the landmarks of the face and oral cavity. In addition to being useful reference points for the dental radiographer and other procedures, facial features provide essential landmarks for many of the deeper structures. So it's important to understand where these landmarks are and how to use them. With regions of the face, on the forehead, that area extends from the eyebrows to the hairline. The temples extend from the lateral to the eyes, and the orbital area is the eye area that is covered by the eyelids. The external nose, we have the zygomatic mylar, which is the prominence of the cheek, and then you have your mouth and lips, cheeks, chin, and external ear. So the face is defined as the part of the head that's visible in the frontal view, and it includes everything that lies between the hairline and the chin. So you need to know that. The face is everything that lies between the hairline and the chin. The skin of the face is thin to medium in relative thickness. It's soft and movable over a layer of loose connective tissue. The skin around the external ear and the ala of the nose is fixed to underlying cartilage. And the skin contains many sweat and sebaceous glands. So you have sweat and oil glands on your face. The lips are also known as labia. They're outlined by the vermilion border. So the vermilion border is that area on the outer lining of your lips, or where a female would put lip liner, or anyone could put lip liner there. The labial commissure is the angle at the corner of the mouth where the upper and lower lips join, so at the corner of your lips. And the nasolabial sulcus is the groove extending upward between the labial commissure and the ala of the nose. So this outlines the area of the lips. For the oral cavity, inside the mouth is lined with mucous membrane tissue. The area that they call the vestibule, it's between the teeth and the intermucosal lining of the cheeks and the lips. And the oral cavity proper is contained within the upper and lower dental arches. So everyone has two vestibules and one oral cavity proper. The vestibule begins on the inside of the lips and extends into the alveolar process of both arches. So the mucosa is thin, red, and loosely bound to the underlying alveolar bone, and the base of each vestibule where the buccal mucosa meets the alveolar mucosa is called the mucobuccal fold. The mucogingival junction is a distinct line of color where the alveolar membrane meets with attached gingiva. So remember, buccal means pertaining to the cheek. We have a labial and a lingual frenum. So frenums are a narrow band of tissue that connects two structures. So for the labial frenum, it goes from the midline of the maxillary or mandibular arch to the midline or the inner surface of the lip. So if you pull your lip out as far as you can and you see that little band of tissue that connects from your maxillary or mandibular arch to the lip that's being stretched, that is the frenum. You can also see buccal frenums if you pull your cheeks out horizontally, and they are located near the maxillary or mandibular first molars to the inner surface of the cheek. The lingual frenum is located under the tongue. So if you lift your tongue up to the roof of your mouth, if you can, and you look, that band of tissue that connects your tongue to the floor of your mouth is the lingual frenum. Gingiva or gingivae, commonly referred to as the gums, are masticory mucosa that cover the alveolar processes of the jaws and surround the necks of the teeth. So the gums surround the tooth like a collar, and they're self-cleansing. So with normal gingiva, it's going to surround the tooth like a collar. It's going to be tight around the tooth, not loose and flappy. They're self-cleansing. They're firm and resistant, and they can be tightly adapted to the tooth and bone. So when they're tightly adapted and they fit the tooth like a collar, you should have healthier gums. When they're not tightly adapted and they're kind of flappy, usually you're more into a periodontal issue. Surfaces of the attached gingivae and interdental papilla are stippled and similar in appearance to the rind of an orange. So the interdental papillae is the space in between your teeth where the gums are, where the gums go in between the teeth that you see like a little point in between each tooth. And the gums go into a point. That's the interdental papillae. Surface color varies according to the individual's pigmentation. So everybody's color of their gums aren't going to be the same. It depends on how much melanin they have in their body. Unattached gingiva, also known as marginal gingiva or free gingiva, is the border of the gingiva surrounding the teeth in a collar-like fashion. So the tissues from the top of the gingival margin to the base of the gingival sulcus. The gingival sulcus is the area around the tooth of the gingiva that is unattached. So that's where you can put your floss in and clean out any debris, is inside of the gingival sulcus. Or if they were going to do a periodontal charting, that is where they put the periodontal probe inside of the gingival sulcus to read the measurements. It's usually about 1 millimeter wide and it forms the soft wall of the gingival sulcus. That is the unattached gingiva. That is the first tissue to become inflamed when you have gingivitis. Other parts of the gingiva, you have the interdental gingiva, also called the gingival papilla, which I talked about a moment ago. It's an extension of the free gingiva that fills the interproximal embrasure between two adjacent teeth. So it's that little point between the two teeth that sit there. The gingival groove is a shallow groove that runs parallel to the margin of the unattached gingiva and marks the beginning of the attached gingiva. And then you have the attached gingiva that extends from the base of the gingival sulcus to the mucogingival junction. So that is under that unattached gingiva where that collar would stop and it becomes very flush with the bone again. The oral cavity proper is the area inside of the dental arches, like I mentioned earlier. Behind the last molar on each side is a space that links the vestibule to the oral cavity proper. Everyone should have a hard palate that separates the nasal cavity above from the nasal oral cavity below. The nasal surfaces are covered with respiratory mucosa, and the oral surfaces are covered with oral mucosa. So there are different names for the mucosa depending on where they're situated in the body. It's always going to be tightly bound to the underlying bone, and the submucosal injections into the palatal area can be extremely painful. So we try not to give palatal injections because when you do have to give a palatal injection, it is very painful because there's not a lot of tissue or cushion there. So another term for the hard palate is the roof of the mouth. So that's the anterior portion of the palate is the hard palate. The posterior portion is the soft palate. It's the movable posterior third of the palate that doesn't have a bony skeleton to it, and it hangs like a limp curtain into the pharynx behind it. It ends posteriorly as a free edge with a hanging projection called the uvula, or that punching bag thing in the back of your throat, and it's supported posteriorly by the fauces. Then your tongue, which is mainly muscle covered with mucous membrane, and papillae. The tongue is there for speech, manipulation of and positioning of food, sense of taste, swallowing, and cleansing the oral cavity. So the tongue consists of the body, which is the anterior two-thirds of the tongue, the root, which is the posterior portion that turns downward toward the pharynx, the dorsum, which is the upper and posterior roughened surface, the sublingual surface, which is covered with smooth, transparent mucosa, and the lingual frenum, which is that thin fold of mucous membrane that extends from the floor to the mouth of the underside of the tongue. Your taste buds are located on the fungiform papillae and in the trough of the large valate papillae, which form a V on the posterior portion of the tongue. The sense of touch is provided by the numerous filiform papillae that cover the entire surface of the tongue. So the filiform papillae do not contain taste receptors. And then the mouth also contains teeth that are either single-rooted or multi-rooted, depending on the size and the location of the tooth. They sit in bony sockets or alveoli within the alveolar process of the maxilla and the mandible. In the mouth, a cuff of gingival tissue surrounds each tooth, and the portion of the tooth that is visible in the oral cavity is called the crown. Thank you.